On the 1st of September, Jodie Munzberg presented to the clinic for an assessment and return to work plan. This is Jodie. She is a 49-year-old receptionist practice manager at Clive Munzberg Physiotherapy. She has presented to the treating exercise physiologist with generalised lower back pain and shoulder soreness sustained from chronic overstretching and overuse in the workplace. Jodie is currently suffering from ankylosing spondylosis in addition to her back and shoulder pain, and complains of fatigue at the end of her workdays. More recently, Jodie has suffered from chronic acute back spasms, which has led her being referred to me from the doctor for a graduated return to work plan. Prior to Jodie's injury, she was working 10-hour shifts a day from Monday to Friday. Jodie's regularly workday would consist of sitting long hours at work on the computer desk to booking clients and balance accounts. However, the other duties include adjusting exercise equipment for clients, assisting the physio where possible, filing, hanging out towels and linen, and also applying hot packs to clients. Jodie's work routine rarely varies from day to day, so movements are chronic and repetitive throughout her work life. On the screen now, you can see Jodie performing some of her daily work routines at her current workplace. On assessing Jodie undertaking her daily routines, it was noticed that she has poor posture, particularly when sitting. This is possibly due to tight hip flexors, putting her in an anterior pelvic tilt position with increased lumbar lordosis. Jodie also is putting a lot of strain on her back when adjusting exercise equipment in her workplace, as she substitutes a safe squat position for a strained back bending position that may be caused due to her weak quadricep muscles. Furthermore, assessment in the form of physical exams will be carried out to determine the cause of these issues and possibly the cause of her injuries. Before undertaking any physical assessments, Jodie underwent an ESSA exercise screening assessment using the APSS, as well as a Neuromusculoskeletal Pain Questionnaire, short form for biopsychosocial assessment, as well as blood pressure and heart rate to determine her safety for exercise. Results of the ESSA pre-exercise screening found no already known risk to exercise, therefore clearing her for future exercise, and there was also no abnormalities with her heart rate or blood pressure. However, Jodie scored a value of 60 on the Neuromusculoskeletal Pain Questionnaire, short form, which indicates that she has some negative pain beliefs and is at risk for disability and failure to return to work based on her beliefs. This score may indicate a referral to an allied health professional such as a psychologist for further intervention. A posture assessment was included in the battery of assessments as Jodie's duties require her to be in a static position for long periods of time. Therefore, weakness or imbalances in posture may be a contributor to her injuries. The following video shows the posture assessment undertaken in the clinic. Hello Jodie, thank you for taking off your shoes and any baggy clothing. We're just going to do a posture assessment now. So what that means for me is that I'm going to be assessing your posture. So I'm going to look at you from the front, side and back. So I'm just going to do that now and assess your posture. So just stand, just casually like you are now. Okay Jodie, thank you. Now, the reason we were doing a posture assessment is because you stand up for long hours in your work, and we just wanted to see if there's anything that's contributing to your problems based on your posture. Okay. The results of the postural assessment found Jodie has increased anterior pelvic tilt when standing and increased lordosis, which also may carry over to her sitting. This indicates tightness of her hip flexors, which may be a contributor to her back pain. A 3-minute step test was implemented to assess Jodie's cardiorespiratory fitness, which a baseline level of fitness is required in her job so that she does not become fatigued during her duties. This task was also included as Jodie has been complaining of fatigue after work. Okay Jodie, thank you for putting on the heart rate band. I've got the watch here now that will monitor your heart rate. So what we're going to do now is a 3-minute step test. So what's going to happen in this test is you'll hear a beat in a minute, which I'll put through my phone, and you've got to step to that beat. So I'll just demonstrate that for you now. So you hear the beats, and you're going to step to each beat. So up, up, down, down, up, down, down. Yeah. And that's going to continue for 3 minutes. So you continue on that beat for 3 minutes. Now, if at any time you feel like you can't continue with the test, you can stop at any time. Okay? After the test, I'm going to get you to sit down and you're going to have a rest, and I'll keep monitoring your heart rate after that. Okay? Are you ready to do it now?
Yep.
Alright, so we're going to start in 3, 2, 1. Step into the beat. Okay. Down, up. The results of this test showed that for Jodie's age bracket, she has below average cardiorespiratory fitness, therefore indicating the need for an exercise program to improve her cardiorespiratory fitness. A sustained wall squat assessment was used as Jodie's work duties involve her working at low levels for large periods of time, especially when assisting the physio and adjusting equipment. Furthermore, quads weakness may be a reason for her increased lumbar flexion when carrying out her duties rather than being in a safer squat position, therefore influencing the decision to assess quad endurance. Okay, Jodie, now we're going to do a wall squat test. So what this test is you're going to be against the wall in a squat position with your knees at 90 degrees. Why we're doing this to just have a look at your lower leg strength, because in your job there's a lot of positions that require leg strength. So the way we're going to do this test is going to come up to the wall, come down, squat position to about 90 degrees, and we're going to see how long you can go for in this position. Now, if you feel any discomfort, you're going to feel some discomfort in this test, but if you feel like you can't go anymore, then just stand up. Okay? Alright, so you're going to come against that wall now, back against the wall, going down to 90 degrees, bending at the knees, and we're going to see how long you can go. And we're timing that with a stopwatch now. Okay, now Jodie, can you take those hands off your knees, please? And seeing how long you can stay for. Jodie reached 35 seconds in the sustained wall squat assessment, which is considered below average, therefore indicating quadricep weakness. This result indicates that Jodie does not have the adequate quadricep endurance to work at low levels, therefore she substitutes a safe squat position for increased lumbar flexion, putting pressure on her back, which may be a contributor to her injuries. A grip strength assessment was implemented to assess Jodie's upper limb strength as she has been complaining of pain in this area. Okay, Jodie, we're now going to do a grip strength test. This is going to give us an idea of your upper limb strength and what else might be contributing to your upper limb, your shoulder problems. So what I'm going to need you to do in a minute is go and hold of the JMR hand grip dynamometer here, and you're going to have your elbow flexed at 90 degrees, and you're going to have one big squeeze as hard as you can. We're trying to get a maximal test here, so as hard as you can. Alright, we're going to start with your right hand first. So you can hold that right arm, get it to 90 degrees, one big squeeze. Very good. Now we're going to do the same thing on the left arm. The results of this test show that Jodie scored a grip strength of 24 kilograms on the left hand and 22 kilograms on her right hand, indicating that she has upper limb weakness. Therefore, this will be a focus in her exercise program. After assessing the clinic in which Jodie works, Jodie's workplace can be changed to better suit her return to work. For example, a sit-to-stand desk could be implemented to reduce her hours sitting. Furthermore, chairs that promote good posture can also be implemented in an effort to decrease her risk of further back problems due to poor sitting posture. Based on the results of these assessments, the workplace and Jodie would benefit from a graduated return to work plan, as her role in the business is critical to its success. Therefore, rehabilitation of her injuries and conditions is important for both the employee and the employer. Based on the assessments undertaken in this video, the goals for her return to work rehabilitation will be to improve Jodie's low tolerance, manual handling technique, overall fitness, and shoulder and back function. Furthermore, the rehabilitation will look to reduce symptoms of ankylosing spondylosis and prevent reoccurrence of injury so that Jodie can gradually return back to pre-employment function following a detailed return to work plan. A steady increase in working hours with reduced duties before a stable increase in duties when working hours are restored should be included in the return to work plan. The plan also should include a supervised gym program twice a week for 6 weeks, which graduates into a home-based program to address Jodie's injuries and conditions. A combination of both resistance training and aerobic exercise and range of motion exercise will be included in the program, as these have been shown to improve the relevant conditions.